Regina Promotions, and the Federal Ministry of Health present Your Health, Your Nurse, and a Whole New You on a new television program, National Pulse Television, showcasing your nurse at work, community health services in your area, reproductive health choices, HIV palliative care, food as your medicine, lifestyle choices to stay fit and healthy, and of course, health news. Reach us with questions and concerns on your health on our first ever Regina E-Clinic, where doctors and nurses are on standby to see you. Keep it a date on National Pulse TV, coming to your area soon. Like I said, my name is Regina Askia Williams. Everybody knows me as former Miss Nigeria, former actress, and former this and that. I went back to school in the United States, had excellent training, and became a family nurse practitioner. And I'm moved by how things work so well in the healthcare industry in the United States. And as such, I am convinced that I could come home and share my skills with the Nigerian nurses and in a reasonable exchange program where we teach each other and learn from each other. Okay, and not just me. I am encouraging a group of skilled Nigerian nurses to come with me in a meaningful exchange program where they will come with me back home and teach the skills they know and help change the nursing industry and raise it to greater heights. To do that, we have to be able to connect with the nurses at home and understand what their situation is, what their frustrations are, and then find ways to sort this out together with them, and then go ahead and learn skills that will help us do our jobs better. To that effect, I partnered with INNA, Inspired Nurses Network Africa. Thank you, let's say it together. Inspired Nurses Network Africa. So we're all partnering because these are the people on ground, these are the people who know what is happening. So we partnered with them in a two-pronged agenda. One, engaging the Nigerian nurses in the diaspora to a meaningful skills exchange, and two, to work on communicating, effective communication by the caregiver to the population of patients we want to work with. We chose a specific population, this population of patients in communities impacted by the HIV virus, to teach them how to prevent the infection, teach them how to protect themselves, teach them how to take care of themselves if they have been infected, right? And I have the support of my nursing school in Wagner College, New York, and I also have the support of different nursing councils here. We are just coming from the nursing council, and I have all that support and the excellent support of the Nigerian nurses, and we are so stoked to get changes in the Nigerian nursing industry. Okay, nurses, welcome. As we're doing the video, maybe we'll go around the room and introduce ourselves and talk about what department of nursing we are in. My name is Regina Askia Williams. I'm a family nurse practitioner in the transplant department of NYU Langone, New York. And this is Stephanie Hornecker. She's my PA. She's not a nurse. This is my daughter helping me out. Okay. And
I am Mrs. Adetumobi. I am a registered nurse and a midwife. I'm from Ogun State.
Okay.
I'm Nurse Adegoke Olaomi Emmanuel. I work with Lagos University Teaching Hospital. I'm a nurse intensivist, so I work in the intensive care unit.
Okay.
I'm Olasuji Kiyoro Catherine, and I'm a nurse from Oyo State, Ibadan.
What's your specialty? No specialty yet, just med search, general search.
Media.
Okay, media. All right.
I am Olasuji Kiyoro. I'm a registered nurse. I'm working as a school nurse at an international school in Osun State.
Okay.
Hi, I'm Nurse Yemika Olajumoke, mental health nurse. I practice in the Lagos State University Teaching Hospital.
Okay.
I'm Maureen Titofo. I'm accident and emergency trained nurse working in the trauma resuscitation unit of the National Hospital.
All right, thank you. I am Mohammed Labaran, a registered nurse working with the Federal Medical Center in the medical department.
Of which states?
Federal Medical Center, Katsina, Nigeria.
Okay.
My name is Nurse Ibrahim Sabi Umerwa, a registered ophthalmic nurse. I work with Christina Eye Center, Christina Skills. Thank you.
Hi, I'm Nurse Adibe Agnes. I am from Lagos State. I work with the private sector in Lagos State.
Okay.
Okay, I'm Nurse Oyukomi Damilola Oshuneye. I'm a registered nurse midwife and I work with the Lagos State General Hospital in Pakoja at the O&G section, Mother and Child Center.
My name is M.M. Okon. I'm a registered nurse midwife, currently practicing at the neonatal unit.
My name is Olabi Ayabiji Gabriel, a nurse and a broadcaster. So I do more of media and broadcasting, purely media.
Nigerian nurse and the curriculum of the nurse training. What do the nurses think will help them? What do the nurses think we can add to their curriculum to help hone up on their skills on providing excellent healthcare services? So let's talk about curriculum and practice. Do you have an idea of how we practice in America compared to how you practice here, and what would help you practice better?
Okay, I said I'm going to talk personally. Personally, I have an idea of how it works.
Again, you're a midwife, right?
Yes, I'm a midwife. Okay, I have an idea of how things work in the United Kingdom because my husband works there and I have an opportunity to talk to one or two nurses that he works with. Okay, let me cite an example, considering the scope of the profession. Like I work in a mother and child center, and so far so good. Lagos State has been one state in this country that has, pushed the healthcare system forward. On my floor, I work at the delivery suite. We have this defibrillating machine, but nobody has ever operated it since 2010 that it has been there. This is the 17th. Now that machine has been there and patients have been dying by its side. The first and the last time I got to know about that machine was when I was in school and they were teaching us all these notes, how you place them, apply the shock and all of that. But not even the doctors in that O&G team knows how to use it. So even when these things are available, the defibrillating machine. Yeah. Now on the floor, we have 4 floors. On the 4 floors of that building, of the Mother and Child Clinic Center, we have that machine on every floor. And it has never been used once. What is the point of having most of them do not even know how to make use of all of this.
Okay, so
yes,
deficiency
in training. So now even if I go to school and I'm being trained how to use something, if I have not practicalized it, if I've not seen it being used, it might be a problem.
There's clinicals. During training, you go to school and then you have exposure to clinicals.
How many school of nurses, universities have these machines for practicals? Most do not have.
But when you do your clinicals, you do your clinicals in the hospital.
In the hospital. I trained in Ogun State. I trained in Ogun State School of Nursing, and then we were attached to Federal Medical Center at Hospital. And when I trained 2004. When I trained, it was not there. We read about this machine in the book. Now, being opportune to see this machine, I know what this machine does. I know what it, how well it is in that place, but it has never been used. Now, we call something continuous nursing education that we do in the hospitals. What they will talk about is something that you know and you still keep doing. That is what they keep talking about.
No new knowledge.
You understand, man? We don't have them sending us on, okay, go for these trainings. The BLS I had was the one I paid for when I was in school.
And it's a good thing that we all did the BLS on this forum. I was really impressed by that. Please, can you give me a shot of Mr. Mohammed, because he coordinated that. Yes, thank you so much. Round of applause.
That's the only BLS I did. And if you don't do these things for yourself, nobody does it for you. Now, the other issues we have is, unavailability of all these instruments he wants to use in carrying out patients' care.
Environmental care.
The environment.
There's no provision for needed.
My accident and emergency. Recently, I was appealed to move to the accident and emergency on the general side for some few months because we are short on nurses. So I had to leave the Mother and Child Center to come out to.
Does your training equip you to offer?
That is because we once had a general nursing training before we went to specialize. So every registered nurse can work in any department. Okay, so the accident and emergency that I am at this moment has 5 couches. And it is in that accident and emergency that my nursing table is situated, and I am sitting right there. And I have this casualty couch behind me, where every accident victim brought in, road traffic accidents, burns, and all of that is being brought in directly into. So there is no privacy for my patients. The autoclave machine is just right by my side. So even when I want to use an instrument and I have exhausted the one I used earlier, probably I'm still trying to go through the process of let me disinfect before I autoclave, I have to just directly carry it like that, wash that way, push back into the autoclave.
Serious hygiene issues.
That is another issue. So how do you even tend to say, okay, I'm doing this in an aseptic, way, technique way? So it is not too sure. You're not too sure of what you're doing. So now it is, I don't think it's about the technique, it's about the curriculum in the schools. I think it's about the places where we are working. Exactly what is there for you.
Yes.
The continuous, this our MCPDP that we do, the trainings we do, what are they putting in for us to learn how to do with new things coming out now? Just like, okay, my friends in the UK said, okay, if a patient comes in, your CT scan is part of the diagnosis. Immediately a patient comes in, you can say, oh yeah, let's do a CT scan, and the result comes out immediately. You don't say, do an MRI. If my patient is going for a CT scan, aside from the fact that it is very expensive, they may not be able to afford it at that moment. Another thing is you will need to follow the patients, go outside and queue at wherever you want to be, leaving the remaining patients at the mercy of either the attendants.
Will you find hospital?
No staff. And you cannot leave your patient to go alone. So it is either you are leaving your patients to the care of a junior nurse or your attendant, so that you can follow that particular patient
To go and get
a CT scan done when it can be in the hospital, out of the hospital. So a lot of things are not from the school. The school is doing their best to say, okay, let us train.
Yes.
But those things they are teaching us, those things that are in the procedure manual,
Yes.
are they visible to us?
Just like she said, we have the scope of practice, but the point is we are not even applying them.
It's not applicable.
The working environment, you have a lot of things you know.
It's not
Yes, that you were
It's
taught in
not
school, you'll
there.
be happy you're going to work.
You
When you get there, you change everything.
you with so much stuff like, oh, we can do this. Just like you're saying with the defibrillator. It's not about you not being able to. My school where
Every
we
lucky you
practicalized and all that. But with time you start practicing. There's this rigid, especially people that have been in the profession for long.
Yes,
I used to say that there are new trends in the profession every day. New nursing trends, new scientific rationales, why you should do this, nursing innovations or plans in your implementation, your actions, why you are doing this. But the point is, some of them are not flexible to say, okay, you're coming in from school, you have new things. You
They
people
will
say
tell you this is how it has been
being
done.
like, this is how we should do, this is how we do it, and that is one thing that is affecting the scope of practice.
Yeah.
I want to do this. No, you shouldn't do this. No, that is when did you come into this?
Another thing is the socio-economic factor of the country is really affecting service care delivery.
Yes.
I've seen a situation where a flashlight was used to complete an operation.
Well,
In the theater, yes.
I'm sorry.
The light went
Oh,
There was
my
a patient, in fact, I couldn't sleep.
Flashlight
Yes.
for surgery.
There was a night I couldn't sleep. When I was telling my husband I couldn't sleep and I explained the situation, he said, why can't your management close down the hospital? A woman was brought, her PCV was very
They
low.
will try to assault.
We now sent someone.
What was low?
The PCV,
Back cell volume.
part cell volume. She was anemic. So she was asked to get blood. They took samples to the lab for grouping and cross matching. The lab scientist said there's no light.
No light
To cross match, yes.
to run the
That we
test.
should we should come back by 12 p.m. This woman died at 12 a.m.
Oh,
Preventable deaths.
so many preventable.
So many.
That's so sad.
It's so annoying.
Things are even that.
I don't actually blame
There are administrative problems.
Yes,
Because
yes.
I had an experience while I was a student. I was posted to, though I'm lucky where I work in my hospital, we have at least 80%. They are okay. You have equipment to work with. But while I was a student, I was posted to a hospital to work, and I was supposed to dress 4 patients with 1 dressing pad, and I refused. I was not going to do it. The woman took me to the storeroom. There were a lot of equipment. She was keeping it for inventory. Yes, so most times this way
They
I'm
do
not this
that.
problem.
They do that.
Wow.
I said I was not going to do the dressing. They said there is dressing part.
Yeah.
And she took me, so you're like, you this know, you're very stubborn. So we went to the room and they brought that dressing part. We took it to the so most times those of these people are nurses, those who are in charge, they are just Let me know it's
And
working.
somehow
They don't want to
have
take
the
action
packing
now.
things up. When you make it
Cutting
obvious,
corners.
yes. There was a time I asked, something happened. We had it was December 2016. There was a road traffic accident. 18-seater buses, 2 had an accident, and already I had 15 patients.
You had, say that again, you had
15 patients on ground already, which I 17 patients, then 2 18-seater buses.
One is unconscious, I have 2 CLD cases, HIV and all that. 17 patients in different units, and I was all alone.
That's 36 plus 15.
You still manage their relatives.
And we were just 3. We were just 3 on duty. 1 patient was on blood, 3 were on oxygen among those 15. When they brought the one with the accident, zero traffic accident, we were unable to attend to those on ground. It was when we were handing over, the night nurse was telling me, "Madam, this patient is dead." Yes, because I couldn't monitor her. We couldn't monitor them. We were battling with these accident victims. We lost them on the floor. There was no space in the hospital again, so we had to put them on the floor, suctioning, cleaning blood. There were children among them, pregnant women. They were coming from the east for Christmas. We're heading to Lagos. Along the Lagos-Ibadan expressway, they had the accident. So we are so short-staffed and everything.
We have cancel and close schools down because they are not fit enough and withdraw their accreditation. I think they should be able to go to the clinical hospitals and close hospitals down if they do not have the standard practice for nurses to work. If an accident and emergency has 5 beds and it is the only hospital in a region of a lot of people, I think it is not suitable. We have a stadium by the hospital that has not been used for any football match but for parties every Saturday. So if that kind of place can be used for a stadium to play football, and the accident and emergency that will save life has just 5 beds, we keep referring to Lasut. Lasut to tell you there is no bed space. So if there is no bed space in Lasut, that patient has nowhere to go. Patients eventually end up dying.
And when they refer from
I think the
Lasut,
hospital should close down.
when they refer from Lasut, my hospital will say we shouldn't say there is no space. And then they will say we shouldn't reject patients.
So you put patient on the ground
Even when there is no patient space.
we should
So what
not
do you do with the patient?
On the couch, on the floor.
On the floor, on the wheelchair, on the couch. I've walked where I had to tie the infusion with a tourniquet on the burglary. And the patient was sitting, yes, it's their choice. See, the education level in this country is even really bad. Because if anyone tells me, "Madam, please, we don't have bed space, can you sit down in the wheelchair while we," I will say no. But when they are told, they will stay. Will you lie down on the bench, on the sofa?
They don't have a
The
choice.
patients don't know their rights in this country.
Yes,
They don't know their
a
rights.
bill of rights.
They don't know their rights.
They don't know their
So
rights.
they do.
There was a time.
It is your right.
They don't know their
Demand for it. Some people don't know their rights.
I once accused the management. I said, "Excuse me, man. Why do you say we have 30 beds when we don't?" She
Yes,
said,
they got
"What's
the
my
bad
business?"
ones because
Yes.
She said, "What is my business? That do I know that in a teaching hospital there is a standard number of beds you need to have, and we just have 10 physical beds." At times, even the nurses, we are part of our problem. But there was a time the CMD came. So one of us had to go and meet
If you
CMD.
talk, you
The
will
CMD
control
came
Monday.
and said, "How many beds do we have?" The senior nurse was just shaking about. He made the head count himself and said 12. And we are reporting 37 when we don't have up to 30. So that's why the management will say don't reject patients because they believe we have enough.
That is only when you only see when the commissioner is coming, when the MD is coming, you see new bed sheets, new pillow sleeves, new things, and immediately they leave. The bed sheets leave.
It's a Nigerian thing.
You only see.
What do you mean it's a Nigerian thing?
It's a Nigerian thing. That's what we do in this country.
Window dressing.
That's what we do.
when the government wants to pass a bad law, they just patch it. The second day
when the
they
government
tie
wants
it
to
off
pass
the
this
road.
road,
Yeah, they
it's
want to
being
patch.
passed.
Yes.
The
I don't even
people
get into
pass
the
this
potholes.
place,
That is it.
their lives are
The
at
second
risk,
day.
they have accidents, nothing is done.
A commissioner's patient will come to the hospital and you give out the
there will be
medication
bed
free.
space, oh.
You will give all medications free to the point of antibiotics that are worth over 4,000 naira will be given free to a commissioner's patient.
And I understand.
And a less
patients
privileged
can afford
patient, a less privileged patient cannot afford the Rosephine 2,800. You will come to the hospital and you write, patient cannot afford. And that patient will die because the pharmacy will refuse to give out a drug to somebody that you can see that this person cannot afford this drug.
But what about the government? Can the government cover some part of the cost of the...
Oh, the government has
said that?
government is
Government is
health
Yes, that's their
I saw you nudge her. She shouldn't say that.
National health insurance thing is another he encouraged people to join NHS so that you can get free. And if you see the NHS scheme, people paying money monthly to NHS, and when it's time to get the free, they start limiting the treatment. If you don't pay,
Reduce it.
essential drugs alone.
I will give you a
Strong antibiotics.
Yes.
So you can move them from the NHIS
Off NHIS list, expensive medications. The NHIS does not have this, but it has finished. Go and buy it. So every time you come, how come every time I'm here, this particular medication has finished? Health insurance.
Yes.
Are there things that the NHS in the US does not cover?
The insurance, health insurance,
Lab investigations.
There is different grades of health insurance. There's the private sector and there is the government sector. Now, if you cannot afford health insurance, the government will cover you for health insurance. And if you can't afford a private sector insurance, you can go that route. So at some point, everybody at different levels has some kind of health insurance. But there are parameters that you have to meet before you fall into a certain group of health insurance. But the fact is, it's available to you. So out here, I don't know how you pay for your medications, how you take care of your own health.
It's cash and carry.
I pay for my treatment.
You pay for your treatment even as a nurse?
Yes.
What about your organization? Who employs you? They don't cover a certain part of your...
No, I see a doctor like a patient. Maybe you don't buy. You don't get even for other patients get into my hospital. You obtain your first outpatient card free. So I get my card normally like every other patient. I see a doctor like every other patient, and I buy my drugs myself if I want to be fine. Because by the time they tell you you have to exempt, and you have to go to the MD that is not going to be on seat, you don't even know when it's going to be there. Will I wait for an MD to give? And the MD will tell you, okay, ceftriaxone, no, we can't give you 4 ceftriaxone. We give you 1. You buy 3.
Okay, so but it's supposed to like an antibiotic course is supposed to be like 10 days and whatever. So how are you gonna give 1?
No, I have to buy. They expect you to buy the rest. Even some investigations. You see, the health insurance.
Maybe like surgery or something, 50% of people for every other.
You work in a private sector, right?
Yes.
Okay, that's good.
I'm Olówó Rasheedat from Kebbi State.
But we're still here.
Come and sit.
Wow. You want to introduce yourself and tell us what kind of nursing you do?
Okay, I'm Rasheedat Olówó. Work with FMC in Kebbi.
Okay.
I'm a registered nurse, registered
very operative nurse.
Welcome.
You're welcome.
We've been talking about the nursing industry, the things we see that we're not happy with, the suggestions, on how things can be corrected, and comparing a scope of practice to what obtains around the world, and how we can make things better. That's where we are at right now. Okay. I have one more question. The relationship between the nurse and the doctor.
My place is wonderful.
At times it depends on the institution.
I think it depends on institution is ever. For me, I work with the best doctors ever. Right now, my best pal is a doctor.
Your husband?
Not me. Okay, I'm not a doctor also, but I'm talking about a female doctor. We are best pals. Best of all.